6 symptoms of pancreatic cancer that will shock you. Pancreatic cancer is a formidable opponent in the world of oncology, and it's often described as hard to catch early because the pancreas sits deep in the abdomen. That means the early warning signs can be subtle, easy to dismiss, and easy to blame on getting older or something I ate. But here's the shocking part. For many people, the first clues aren't dramatic. They're quiet changes. Things you might notice in the mirror, in your appetite, or in the bathroom. And that's why they get ignored. So in this senior guide video, we're going to cover 6 early signs you should not ignore. And I want you to stay with me until the end, because I'm going to give you a simple 2-combination rule that helps you decide when it's time to stop watching videos and actually call your doctor. Now, before we start, I want to speak to you directly, especially if you're in your 50s, 60s, or older. A lot of seniors have been trained their whole life to be tough, stay quiet, and not make a fuss. Many people tell themselves, "I'll wait. I don't want to bother my doctor. I don't want to worry my family." But listen carefully. Your health is not a burden. You are not being dramatic for paying attention. You are not weak for getting checked. And if this video helps you catch something earlier or helps you push a spouse, a sibling, or a friend to get evaluated, then it could genuinely change someone's life. That's why I'm asking you from the heart. Subscribe to Senior Guide right now. Not for numbers, not for vanity. Because this channel is built for people like you. People who need calm, clear, senior-friendly health information that helps you know what's common, what's not, and what should be checked sooner rather than later. Subscribing helps this message reach more seniors who are quietly dealing with symptoms and hoping they go away. Now, quick disclaimer, this video is for educational purposes only, not medical advice. Always consult a qualified healthcare professional for concerns about your health. Many of these symptoms can be caused by less serious conditions. The goal here is not fear. The goal is awareness and timely evaluation when symptoms are new, persistent, or unusual for you. All right, let's start with a simple explanation of the pancreas. The pancreas is a vital organ tucked deep inside your abdomen. It plays crucial roles in digestion and blood sugar regulation. It helps you digest food by releasing enzymes, and it helps regulate blood sugar by producing insulin and other hormones. Because of where it sits and what it does, problems affecting the pancreas can show up as changes in digestion, appetite, stool, urine color, skin, energy, and sometimes blood sugar. Now let's dive into the 6 signs. Sign number 1, jaundice. Jaundice is one of the most visible early warning signs, and it causes a yellowing of the skin or the whites of the eyes. This happens because of a buildup of bilirubin, something your body produces when it breaks down old red blood cells. In a healthy body, bilirubin travels through the bile duct and exits through your digestive system. But if something blocks that pathway, bilirubin can build up in the bloodstream, and that leads to the yellow tint we call jaundice. Now here's the important part. Jaundice can be caused by several conditions, including hepatitis and gallstones. So jaundice alone does not equal cancer, but it is a signal that something is wrong in the digestive or bile system and should not be ignored, especially if it's new. And stay with me, because sign number 2 is the clue that often shows up right alongside jaundice, and a lot of people completely miss it. Sign number 2, persistent nausea and vomiting. Occasional stomach upset is normal, but nausea and vomiting that keep coming back, especially without a clear cause, can be an early sign worth checking. One reason this can happen is that as a growth in the pancreatic area develops, it may press against the stomach or small intestine, interfering with digestion. That pressure can cause a partial blockage, leading to feelings of fullness, nausea, and vomiting. These symptoms can be especially noticeable after eating, particularly after heavy or fatty meals, and they may be paired with loss of appetite or feeling full quickly. The key word here is pattern. If you're noticing this repeatedly or it's getting worse over time, That's when it becomes important to talk to your healthcare provider. Now, the next sign is one that seniors often dismiss as dry skin, but it can be connected to the bile system. And this is where many people lose time. Sign number 3, persistent, unexplained, itchy skin. This kind of itching, also called pruritus, can be intense, widespread, and stubborn. It may not improve with typical moisturizers or over-the-counter anti-itch creams. One reason itching can happen is when bile flow is blocked and bile-related substances build up in the body and affect the skin. Sometimes itching can even show up before the yellowing of jaundice becomes obvious. Now again, itchy skin can be caused by many non-serious issues: dry skin, allergies, eczema, weather changes, or new soaps and detergents. But if the itching is persistent and unusual for you, especially if it's paired with yellowing, dark urine, or pale stools, that combination matters. Next, number 4. Abdominal pain. Upper abdominal pain can be an early sign, and it often has a certain pattern. It may feel like a dull ache, sometimes radiating into the back. Some people notice it's worse when lying down and feels better when leaning forward. Others notice it worsens after meals, especially fatty foods. Now, abdominal pain is extremely common and can come from many causes: indigestion, reflux, ulcers, gallbladder problems, or pancreatitis. But if the pain is persistent, severe, unusual for you, or paired with other symptoms on this list, it deserves medical attention. Listen to your body. If something is out of the ordinary for you, don't talk yourself out of getting checked. Now we move into a sign that's particularly important for older adults because it can show up quickly and gets dismissed as just age or just lifestyle. Number 5. Sudden onset of diabetes. The pancreas helps regulate blood sugar through insulin. When something interferes with that function, blood sugar can rise and diabetes can appear. The key idea in this script is the sudden onset pattern. Diabetes that seems to come on quickly, especially in someone with no prior history. This does not mean that everyone with new diabetes has cancer. Far from it. Most diabetes is related to other factors. But if diabetes appears suddenly and is paired with other symptoms like weight loss, appetite changes, or digestive issues, it's worth discussing with your doctor whether additional testing makes sense for your situation. And now the last sign is one of the most practical because it's something you can notice with your own eyes, yet people often ignore it. Number 6. Changes in the color and consistency of stool and urine. When bile flow is blocked, urine may become darker, brown, or amber because bilirubin levels rise in the bloodstream. At the same time, stool may become lighter or clay-colored because bile isn't reaching the intestines the way it should. Pancreatic issues can also interfere with fat digestion, leading to stool that looks oily, floats, and smells unusually strong. This happens when undigested fat passes through the digestive system. Again, diet and medications can sometimes change stool and urine. But persistent changes, especially when combined with jaundice, itching, nausea, or abdominal pain, should be discussed with a healthcare provider. Now let's quickly talk about risk factors. Not to scare you, but to help you understand who should be extra alert. Risk factor 1. Genetics. Family history and certain genetic syndromes can increase risk, including specific gene mutations like BRCA1 and BRCA2. Risk factor 2. Age. Pancreatic cancer becomes more common as people get older, and many cases are diagnosed after age 65. Risk factor 3. Smoking. Smoking is a major modifiable risk factor, and risk decreases after quitting. Risk factor 4. Chronic conditions, like diabetes and chronic pancreatitis. Risk factor 5. Obesity and a sedentary lifestyle. Risk factor 6. Certain chemical exposures, especially in some industrial environments. Now here's the part I promised you to stay for: the 2 combination rule. This does not diagnose anything, but it helps you decide when to act faster. Combination 1. Jaundice plus urine and stool changes. If your eyes or skin are turning yellow and your urine is darker or your stool is pale or clay-colored, do not wait weeks. Call your doctor. Combination 2. Persistent digestive symptoms plus metabolic change. If you have ongoing nausea, loss of appetite, feeling full quickly, or upper abdominal discomfort and you're losing weight without trying, or you have a sudden blood sugar problem, that combination deserves evaluation, not just, let's see if it goes away. Now I want to end with reassurance because seniors need calm truth, not panic. Experiencing one or even several of these symptoms does not automatically mean pancreatic cancer. Many can be caused by less serious conditions, but pancreatic cancer is difficult to detect early, so the safest approach is simple. Notice patterns. Don't be paranoid, but don't delay when symptoms are persistent, worsening, or clustered together. And please remember this. If you get checked and it turns out to be nothing, you didn't waste anyone's time. You protected your health. You protected your family. If this video helped you, please like it and subscribe to Senior Guide. Your support helps us reach more people with crucial health information, especially seniors who tend to stay quiet and wait too long. And for the comments, just answer yes or no. Have you noticed any unusual changes in digestion, energy, urine, or stool recently? Thank you for watching, take good care of yourself, and I'll see you in the next Senior Guide video.